Welcome to LPN LaunchPad's review for medication administration, legal and ethical aspects. This session will clarify federal, state, and facility regulations, valid prescription requirements, and methods to prevent and report errors. Understanding the legal and ethical components of medication administration is not just a requirement, but a responsibility that ensures patient safety. It's our commitment to adhere to laws and policies, define the scope of nursing practice, and minimize liability by preventing errors. This review covers federal, state, and facility regulations, legal prescription elements, types of medication orders, standing, stat, single, PRN, and error prevention and reporting strategies. It also includes 3 engaging NCLEX style questions to test your understanding and prepare you for the exam. The primary objective is to uphold compliance with federal, state, and institutional rules, safeguarding patients and healthcare providers from legal and safety risks. Federal laws like the Controlled Substances Act are enforced by the DEA, classifying drugs with potential for abuse into schedules, from Schedule Y, no medical use, highest abuse, to Schedules 3 through 5, lower abuse risk. State Nurse Practice Acts define each nurse's scope of practice, including who can prescribe and administer. They vary by state and are crucial for avoiding scope of practice violations. This is an important NCLEX focus. Facility policies may exceed legal minimums, often requiring double checks for high alert meds, special storage of controlled substances, and additional education or certifications. NCLEX study tips for regulation. Know the schedule system, especially since Schedule 2 medications do not require refills and require written prescriptions. Remember that policies typically exceed state requirements and never violate local nurse practice acts. The main objective for prescription legality is to validate orders thoroughly, ensuring the nurse and patient are protected from errors or legal issues. Essential prescription elements include the patient's full name, date, time of order, drug name, dose, route, frequency, duration, and the prescriber's signature. Any missing component invalidates the order. Special instructions, like with food, guide safe administration, while verbal orders, limited to emergencies or prescriber unavailability, must be read back, confirmed, and signed within policy-specific timeframes. NCLEX study. Tips. Never accept incomplete orders. Verbal orders require prompt signature and read-back verification, and question any unclear directive rather than guessing. The objective regarding order types is to correctly interpret and administer medications under standing, stat, single, or PRN directives. Standing orders are policy-based or protocol-driven directives for recurring scenarios. They allow the nurse to initiate treatments, such as acetaminophen, for mild pain based on facility guidelines. Stat orders require immediate one-time administration, e.g., epinephrine in emergencies, whereas single, one-time orders specify a single dose at a specific time, e.g., a pre-op antibiotic. PRN orders are given as needed, requiring a reason, such as pain or nausea, and a minimal interval. Nurses must document the indication and evaluate its effectiveness. NCLEX study. Tips on order types. Standing orders are recurring, stat means immediate, single is one time, and PRN includes a clear indication plus timing. The objective of error prevention is to adopt strategies that prevent medication mistakes and appropriately manage them when they occur. Common causes of medication errors include rushed environments, distractions like phone calls during med passes, and confusion over look-alike, sound-alike drugs, making tall man lettering vital. We can prevent errors and ensure patient safety by strictly following the 9 rights, reconciling meds at admission, transfer, discharge, and avoiding omissions, duplications, or harmful interactions. This approach should instill confidence in your practice. After an error, the nurse should assess the patient, notify the provider, complete an incident report, and chart the drug administration in the permanent record without labeling it error. NCLEX study. Tips. Always check the patient's condition first if an error is suspected, document and report immediately, and focus on fixing system issues rather than assigning blame. NCLEX. Question 1. Which controlled substance schedule covers drugs with no accepted medical use and high abuse potential? A. Schedule 2. B. Schedule 1C. Schedule 4D. Schedule 5. The correct answer is B. Schedule I, exemplified by heroin and LSD, which lack recognized medical use and carry the highest risk of abuse. NCLEX. Question 2. A patient has a standing order for acetaminophen 650 milligrams per oral every 4 hours as needed for mild pain, greater than 3 out of 10. What best describes a standing order? A. Administer once, then stop. B. Policy-based or routine for certain conditions. C. Given at a single specified time. D. Valid in emergencies only. The correct answer is B. Standing orders function as policy-based protocols that are repeatedly used under specific conditions, such as mild pain. NCLEX. Question 3. A medication error is discovered, but the patient seems unharmed. What should the nurse do first? A. Document no harm and move on. B. Call the prescriber to apologize. C. Assess the patient for delayed effects. D. Complete an incident report in the chart. The correct answer is C. Evaluating the patient is the top priority, then following the facility's reporting steps. Incident reports are separate from permanent records. Key takeaways include adhering to federal state laws plus facility policies, ensuring complete prescriptions before administration, understanding the different types of medication orders, using the 9 rights to reduce errors, and focusing on patient well-being if mistakes occur. Please leave any nursing school questions in the comments for a prompt reply. Like, subscribe, and comment to support this channel. If this channel reaches 25 subscribers by the end of April, I will give away a free LPN LaunchPad Complete Study Companion ebook. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.